Okay, so let's do a step by step, and I'm out of the frame, you can't really see me, but you can see this arm though. Okay, I'm going to teach you step by step how to collect a blood sample from my fake arm. Take this technique and try it on a real patient. Please do this at a clinical site or with an instructor. Don't just do this on your own. Actually, you can. If you have a fake arm at home and you want to practice on the arm, you can definitely do so. So, what do we do first? First thing is first. And remember, I'm out of the frame, but listen to my voice. Hear me speak. Here we go. What do we do first? We introduce ourselves to our patient. Hi, my name is Milka. I will be your phlebotomist for today. May I have your first and last name and date of birth? Your patient will tell you some questions that you should ask your patient. 1. Are you fasting? 2. Do you have any history of syncope? 3. If it's a woman, have you had a mastectomy? And 4. Which arm do you prefer? All right, so let's get started. I wash my hands. First, introduce yourself, verify, wash your hands. I'm washing, I'm washing. My doctor has ordered, let's see, my doctor has ordered CMP, a A1C, and an ammonia level. Okay, so I said my doctor ordered a CMP, an A1C, and an ammonia. What is the correct order of draw? Of course, it's going to be my SST, my green, then my lavender. Let's go and apply our gloves. All your patients are infected with something. That's not what I said. I didn't say it. OSHA said it. OSHA said your patients is infected with something. So if my patient's infected with something, this is what I need. My standard precaution. PPE. Here we go. So I'm going to place my gloves on. Here's my gloves. Take my tourniquet. Tourniquet stays on for no longer than a minute. If you need me to go slow, I'll go slow. Just like that. Make sure we're doing it tight now. Put your finger, cross over, lift, and place. There we go. There's my tourniquet. No longer than 60 seconds. So here we go. We palpate. We're palpating. We're feeling. Which vein feels good? Oh, I like that one. I've located my vein. Remove the tourniquet. Let's get it going. I have all my equipment already, but let's go and do the steps. Get your equipment. I need an alcohol. I have gauze. I have my tubes. I'm going to use a 21 gauge straight needle because my patient's veins is beautiful. They're healthy. If they're not healthy and they're small, fragile veins, or I'm working with a pediatric patient or a geriatric patient, I would use a butterfly, a 23 gauge, 25 gauge. But my patient, plumped, beautiful veins, 21 gauge. I have my hub. Here we go. Which part do I remove? There's two parts to it. The part that has the rubber at the end. Attach. Okay, it's snug. I do not want it to come off. Let me clean the side. Start from the center, circular motion moving outwards. Now, I see that CLSI says that we can go like this. Okay, circular motion outwards. There you go. I'm gonna wait for it to dry. Am I gonna do this? No. Am I going to say, dang? No. You wait 30 seconds for this to dry. All right, I'm waiting. Here we go. Apply the tourniquet again. Make sure that the tourniquet does not touch the site. And if it does, what do we need to do? Re-clean it again. All right, here we go. So I have my needle ready, and with my fake arm ear, I apologize, but I haven't been getting blood for return on this. So I'm just gonna show y'all, this is how you stick and this is how you switch your tubes, okay? Here we go, first thing, I always need to remember, bevel up, not this way, not to the side, bevel up. Depending on how the vein is, if it's deep or if it's like a shallow vein, will indicate how I will insert my needle. Originally, it is 15 to 30 degrees, right? So I see it, I'm not going to touch it again, I anchor. When I anchor, I am doing it away. I'm not this close. You see, I'm not this close. I'm doing a little further down. Here we go. 1, 2, 3, and I just glide in. The whole needle does not need to be in the patient's arm. I take my first tube. I know that I'm doing for an SST. Here we go. How I do this, I am going to use, let me see, don't ever do that, right? So I'm going to use the flaps here, and of course, never let go. Let me see if I could do that from this angle here. Okay, here we go. So this hand never lets go. My fingers here and push. Okay, that's one. I remove. Watch how I remove. Push. This hand never moves. Invert. Next one. I have an ammonia level. There we go. Right here. Push. Oh, okay. Next one. I have my A1C. Last two. Here, one last time. There we go. Because I'm moving so fast, my tourniquet did stay on. This has to be done within 1 minute. If I am not moving at that speed, let's try this again. I have my first puncture. I have blood return, tourniquet, pop. Next two. Here we go. 1, 2, 3, done. There we go. Put my next one. 1, 2, 3. Invert. Invert. Not this. We're not doing this. We're inverting. Or you can go like this. Now I'm done. We're going to hover. We're not going to press down. Again, let me fix my camera. Hold on. We are not going to press down on the needle. We hover. Hover. 1, 2, 3. Pull. And it's either I do that from here away from the needle. So let's try that one more time. I can flip and clip, or 1, 2, away into a sharps. Another thing that I wanted to add, let's say that you're dealing with a patient that has deep veins, deep, right? Here's how you will anchor. We're not going like this. That's a no. Get away with me with that needle. Usually, we just do a simple glide, right? With a patient that has a deeper vein, we're going to angle it just a little different and go inwards. So, there's a difference. Glide or